Good afternoon, everybody. Today we're going to be talking with Dr. Taylor Reyes, who's on that side. She is actually one of my women's health / physical therapy mentors. She got to deal with me for 12 weeks-ish when I was a baby PT, and I can't imagine having gone through my rotations without you. I just learned so much through that rotation and all the different ways that we can treat. And now you have your own clinic that is called Fire Physical Therapy. And I'm just so excited for our listeners and our viewers to get to learn a little bit more about you, about what you do, about infertility and your new class, labor conditioning. So if you wouldn't mind, give everybody a little bit of background, like where you went to school, how you got into women's health, all that good stuff.
Sure, yeah. So I went to undergrad at Texas Women's University in Denton. It was great. And then I went to grad school. I got my doctorate in physical therapy at Hardin-Simmons University in Abilene, Texas. And then I went and worked at an outpatient ortho clinic in Richardson, Texas for about 3.5 years. During that time, I got my certification in functional manual therapy through the IPA. So it's not conventional physical therapy. It's a little bit more osteopathic, and we look at things a little bit more holistically than some may, just depending on your background or what you've experienced. So with that training, it's, you as a student, I knew I wanted to do women's health. I knew I wanted to do women's health, medical missions, and become a CFMT. So as far as reaching that women's health, the reason I wanted to do that, I guess I should say, is, and not to get too dark or morbid, but there's a lot of people who have experienced trauma, sexual trauma or rape or things like that, and it can really leave a deep impact in someone's life, not just cognitively, but the way they're able to connect with their partner as well. And it just, to me, that just seems really awful that, one, you have something taken from you, and then it stays with you in the way that you can't connect with your partner and possibly ruin a marriage. And that just didn't seem right to me. So that kind of was the catalyst to me wanting to do women's health and just helping that specific population. And when I learned more about it, it was like, wow, basically anyone with a pelvis needs women's health or pelvic floor physical therapy, not even just women. So that's just, I won't go too far into it, because if not, we'll be here till dinner time. So and then when I became pregnant, my daughter is 20 months old. I, just wasn't sure about what things were going to look like for me, if I was going to stay at home or not, work full time. So I ended up starting my own practice called Fire Physical Therapy. It's functional, intentional, restorative, empowered. That's what FIRE stands for, not the element. And I actually just work 2 days out of my home so that I can be mom and professional. So, and I have family that comes and stays with her. She doesn't sit in a playpen while I treat patients. She's sought after. So, so that's a little bit of me in a nutshell.
That's amazing. I know that there's so many moms that do watch this that have a hard time imagining being a professional and still managing your kiddo. So it's amazing that you could combine the two and still, raise your child how you want and still have an amazing career. So you're amazing. I heart you. We're not going to get any further than that.
My husband's amazing. He has been so supportive. He actually flipped our office into a clinic for me because he's a handyman superstar. So,
yay, Mr. Reyes. We like him too.
Yeah.
Okay, so we're going to get into the meat of things. I want you to kind of introduce infertility a little bit. I know for me, I have a lot of women that have been asking for this, even just like the basic, some of the bare bones about it. There are a lot of different types of infertility. I do really want to hit on some of the ones that we treat as physical therapists, because there are types that we don't treat, that we don't have the ability to affect. But I know that this is something that you have experience in, and are definitely super knowledgeable in the area.
Yeah. So basically, I think that's a really good point that you brought up, because we, although PTs are superstars, we can't treat absolutely everything. So what we can treat is things with mechanical restrictions. And what I mean by that is, our body is made up of connective tissues and muscles and ligaments and joints, et cetera, et cetera. So when we're looking at the reproductive organs, like the uterus is a muscle. It's not the same type of muscle fibers that say your bicep is, but it still is a muscle. It still can have connective tissue or fascial restrictions around it that limit its general function. And then connective tissue or fascia can also, we're just going to say this for imagery's sake, wrap around the ovaries or fallopian tubes. And there is a really good study. It's a 10-year retrospective study looking at female infertility mechanical restrictions. And it suggests that 90% of female infertility is related to mechanical restrictions in the ovaries, fallopian tubes, or uterus. Now, within that study, it did look at using manual therapy to treat those restrictions, whether or not they're having IVF or whether they haven't started using IVF. And what it shows is that using manual therapy in addition to of IVF just makes a better environment for the egg to implant, and it's a less hostile environment. So, and this also goes along the line. Some people come to be treated for painful periods because you should feel things during your period, but it shouldn't be painful, and you shouldn't have to pop a few 100 milligrams of ibuprofen to get through the day. So these structures, along with surrounding organs or viscera, are things that we also treat as well. So it is all, when we talk about physical therapists treating female infertility, it does stay within our scope of practice. It is a hands-on thing. And so not everyone is a candidate for that. But what I tell people that come in is that, if they're somewhere along the journey of infertility, whether they're about to start IVF, we don't want if there's any possibility that you could be pregnant, we're not doing this, right? Like, it's something for when we know you're not pregnant. Because there's, we just don't want to risk anything. So,
right. And with a lot of our treatment, it is very hands-on. It can be very intensive. And I know, like, I've actually had Taylor treat me a little bit in my abdomen for some different health issues that I have. And that wasn't comfortable all the time. It wasn't fun all the time, but it did change for me significantly. And I know for some of your women that this isn't going to be necessarily a day at the spa.
No, yeah, and the idea is that it's not supposed to be painful, or it's not supposed to be uncomfortable, but it's just, if you have a knot in your trap and your muscles are sore, and someone goes to massage you, you think, oh, that that kind of hurts so good, or it's like you can feel where it's restricted, and to a certain degree that can apply to this area. But treatment is very gentle. It's not something you're muscling or cranking through, and it's very specific. And excuse me, I think even if you have incontinence problems, because you may think, well, I'm not trying to get pregnant. How do I know that maybe this could be applicable to me? Well, if you've ever had painful periods or irregular periods or polycystic ovarian syndrome or endometriosis, or really if you just haven't had your normal cycle with flying colors and no pain, then you could possibly be a candidate. And how to know that is you can just get evaluated by someone who knows how to treat the viscera or do visceral mobilizations, and they can tell you, like, hey, things look great, or there's something funny going on here. And there's even people who don't have infertility. Like, I've had clients, and clients have reported, and I've had permission to share this, but we won't get too much detail, that when they're normally when they're, say, putting in a tampon or putting in a menstrual cup, that they have to insert it at angles. That is, whether it's right, left, or something funny. But then after treatment, they don't have to angle it. They can just insert it straight up. And I think that just is a really great indicator of how much mechanically things are changing and realigning, for lack of a better word. And then the same thing, like the bladder sits right on top of the uterus, and that also has connective tissue, and that's also muscle. And sometimes the bladder can just get a little too cuddly with the uterus, again, for imagery's sake, and we got to release that sucker. And sometimes people have reported improved continence or just less urgency when, you know, maybe they haven't drank a ton of water, things like that. And especially if you have chronic constipation, that's a big one. That can also play a role. Or say you've had like, you know, you have irregular cycles and you also have had right hip pain issues for a while. You know, that those are all just signs that, hey, maybe this could be helpful for me. So
exactly. I need to come see you, except you're in Texas.
Well,
Yeah, so I know like with a lot of this releasing, like there are things that maybe women aren't necessarily realizing can be playing into each other, like the right hip pain with infertility. Like they probably wouldn't connect those. Like, do you see that a lot?
yeah, you know, and I will say this too. It's not because, you know, it's not, a lot of people have no idea the stuff that we can do. So it's not like I have hundreds and hundreds of infertility patients either, you know. So in the sense of like, oh, I see this a ton or I see that a ton, it's more like it's stuff that you see in other colleagues that I know of that treat this as well. So one point of this is to get it out there because, you know, it's in regards to infertility, it's a long road and it's a very painful road. And it can be a very expensive road. And so the point of this is like, okay, what can we do to optimize your potential, right? Like whether you do, even if you do get out, like this could be used in addition to like in conjunction of IVF or other infertility technology, right?
Yeah.
Not just IVF. So,
Right, that's amazing.
Yeah. So I had a thought. I don't remember where I was going with it, but just the symptoms that we commonly see. Yeah, and a lot of like bloating, constipation, or you know, just if you're not sure, like if someone's thinking like, oh, I wonder if what I have going on could contribute, just ask.
Yeah,
right?
definitely.
Yeah, ask. So
yeah, so I know that this is a big deal, and I'm so excited that as pelvic floor physical therapists, we're able to treat this, and I'm even more excited for me because I got to learn from you on how to treat this and some of the different manual techniques. I know that I'm actually super excited to talk about after we worked through some of this fertility stuff and some of your new classes that are helping soon-to-be mamas learn to be mamas in a more physical way than maybe some of the other classes are doing. So let's talk about your labor and conditioning course.
Yes, so labor conditioning is a course that it's kind of a 3-step course that I designed to basically help women either improve or start or just maintain a certain level of fitness where the exercises are designed around helping you meet the demands of natural delivery. And, you know, and even if natural delivery is not your goal, which is completely okay, this stuff is still applicable because being pregnant is like your blood volume increases and you have to, you know, move oxygen more. And it's just, I mean, you're becoming an athlete whether you want to or not. So we break it up into stages where the beginning is just developing an exercise program. And I'm not a personal trainer. I just create a program for you to use. So whether you're, you know, you never even broke a sweat on purpose in a decade, you know, depending on your fitness level, or whether you're an Ironman athlete, we basically just look at what you are doing or not doing and tweak it to say, hey, this is going to really give you a bigger bang for your buck when you deliver, right? Whether it's endurance, being able to get into that deep squat, because when the baby comes through the canal, your pelvis needs to kind of open up and flex. So doing things to help promote that natural movement. And then just, you know, laboring can be a very long process. And so you're not going to just go out and run a marathon, right? So it's all, and, you know, it shows that the more fit you are, the better your outcomes are, or not even fit, but just the more conditioned you are, the better your outcomes are when it comes to delivery, less complications. And then even one study showed that if you are fit during pregnancy, that you, even for first-time moms, you're more likely to deliver before 40 weeks, which is not always the case. I have a friend who she just had her baby like 41 and a half weeks and she's very fit. So, you know, it's just a rule of thumb, right? So
every now and then they get it wrong on the ultrasound about how far you are, or just a little wrong, just a little off.
That's all it is. And the second stage is really looking at pelvic mobility, and then if you have pain, like if it's, because I do these sessions, I do workshops, and I do in-person sessions, and I do virtual sessions. So if you're in front of me, then if you're having pain or we see specific issues in your pelvis that aren't moving correctly, we use manual techniques to work on that. And then the third component of it is working on perineal stretching, so that the tissue basically, when the baby starts coming out of that little hole, starting to stretch that, because really massage it's nice, but it's not functionally going to make a difference. We want to impact the connective tissues to actually, if there are myofascial restrictions, we want to address that so that you're not, tearing through that. And then it also just improves your proprioception in that area, because during delivery, sometimes the labor and delivery staff, whether you're with a midwife or at a hospital or whatever, they'll say, hey, do you want a mirror? And I know during my delivery, I was like, no, thank you. But in hindsight, after experience, like, well, I probably use that. But in my experience, though, be even like, she just gently pressed, like push here, like in the perineum. And I was like, oh, that makes sense. So, and because I already knew a little bit about that area on me personally, it made more sense when she was saying that. It wasn't the first time I had tactile cueing in that area. It wasn't the first time that, it's not like, oh, there's just this, world of pelvis down there that I've never acknowledged before, right?
Right, and that's really important, just to be able to use it appropriately.
Correct. Yep. So those are the three stages. And then also the third also involves going over body mechanics and postural strategies for the fourth trimester, because a lot of injuries occur with repetitive activity, especially if you're not prepared for it. In what is breastfeeding? A lot of repetitive activity in positions you're normally in. What is changing diapers? Repetitive activity that you don't normally do, bending over like the changing table at 2 a.m. There's just, and lifting the car seat, that you're throwing your body into boot camp. And really, I think we have it flipped a little bit about how we look at maternal care. Women are really coddled and so, oh, go sit down when you're pregnant, and which is nice. I mean, it is exhausting, especially the first trimester, but during pregnancy, like, this is a time to prepare. Like, your world is about to be rocked. And I think any mother can, attest to that. And then the postpartum period is where you need to be coddled. That's where you're recovering. That's where you shouldn't push your body beyond what it can be doing. The pregnant body is very resilient, and you can do a whole lot. And unless you're high risk, there's really, well, we can go more into that, but if you're high risk, exercise is a different story. But if you're not high risk, like, you should be moving and preparing your body. So the postpartum period is, hey, we just had a controlled trauma. We need minimum of 6 weeks to heal based on the physiological principles of tissue healing. And hey, I'm not sleeping. I'm probably not eating well. I'm super stressed. I have hormonal influx. Like, what the heck? That's when we need to be coddling. So,
and you have a new life form, like, screaming at you for sustenance and changing and love. And they're so cute, but they are loud.
Mm-hmm. Mm-hmm. So
that sounds amazing. I can't imagine that your phone must be ringing off the hook just for women to learn about this.
Well, it's I mean, we're learning a lot about it, so it's really, or I'm teaching people a lot about it, so it's good. It's really good.
Even women in Florida can come to you for this, as you have this via a virtual, is it like a session?
Yeah. So it would be considered wellness, right? So it would just be a wellness consultation type thing, and they could totally set up an appointment with me through Facebook, if you're watching this through Facebook, or if you want to email me at firephysicaltherapy@gmail.com. I do virtual sessions to go over education and things like that. So
it's so exciting to see another therapist like doing this stuff over the internet, which is such a powerful tool. But now, like, we don't have to always have our hands on you to treat you and help you do these things.
I know. 5 years ago, like, I would have been like, virtual physical therapy, what is that? Like, if I can't get my hands on you, but you know what, especially with women's health, and especially when you're addressing the pelvic floor, it's just so much of it is education. And I mean, you know, yeah, we could talk about that, but it's a lot of education. And if you don't get the basics down, no amount of manual is, you're just running in circles. So.
Well, this has been amazing. I can't thank you enough for coming on and just giving the viewers, another aspect, another way to look at infertility and different parts of labor. I really appreciate it. And then, like we said, if we wanted to get a hold of you, you're definitely going to be tagged in the Facebook, so they can Facebook direct message you or go on to, I'll also make sure that I throw in the Fire Physical Therapy, your Facebook page, so they can go and check you out on there. I'll probably insert your website as well, because it's a pretty nifty website, just saying. Any other way that you're excited to schedule or just get to talk to these ladies? You said email?
Yeah, email, firephysicaltherapy@gmail.com. That's great. I'm also on Instagram. Yeah, so my handle is @firephysicaltherapy. You can DM me. I do I think most of my stuff comes onto Facebook as well, but I put up a lot of videos on whether you're trying to rehab diastasis recti or just general wellness, or just stuff like that.
Guys, if you're interested,
a little bit of branding.
I watch them all the time.
And you'll get to see my daughter too. She's my little sidekick. So
the adorbs. Thank you so much. I'm so excited to share this with everybody.